So, hello everyone, this is Vikas and I welcome you all to the Praktani Adda session 79. The idea behind organizing this Praktani Adda is to provide a platform where all the brothers can join and meet with each other, and in the process, they can gain knowledge from alumni brothers and become more successful in their career paths. So, with that in mind, today we are here with Chandan with the topic transition from medicine to management. Whether it is right or wrong, so Chandan will speak on that topic. So Chandan is from RKMV level 2 batch. So he's currently working as Chief of Staff, Medanta, Gurugram. After Vidyapit, he did his MBBS and MBA in pathology from VCMS and GTP hospital. And he's trained in oncopathology at AIIMS New Delhi. Then he shifted from diagnostic to healthcare management by pursuing MBA from IIM Kolkata. After his MBA, he has worked in BCG, where he gained experience in strategy consulting. Now he is the chief of staff Medanta. With that, I now hand over the stage to our very dear Dada, Dr. Chandan Dar. Dada, the stage is all yours.
Yes. Thanks, Vikas. Thanks for the introduction. Hi, everyone. So I'll just made a small PPT for everyone, but I would like this session to have more interactive. So you can stop me for any question if you have. And I would like to thank the Praktani team, and I'm really humbled and honored to talk before you on this topic, which is very new to me as well as I'm still learning the management side of the healthcare, working as chief of staff at Medanta. So I'll just share my screen. So as Vikas has already introduced that I'm currently working as chief of staff with Medanta Group of Hospitals. I'm from alumnus of Vidyapit 2002 batch 10th, and I did my MBBS and MD from Delhi University as well as MBA from IIM Calcutta. So before moving ahead, I would just like to emphasize that my journey from Vidyapit to Medanta has been really fascinating. And I have been privileged till now to be an alumnus of great institutions. And the foundation was built by Vidyapit, where I was surrounded by great people with great minds. And then it was a constant motivation to evolve and upgrade while I interacted with them. After that, I moved to Delhi University to pursue my MBBS and MD from UCMS and GTB Hospital. After that, I did my senior residency at AIIMS New Delhi in oncopathology, or I would say oncodiagnostics, where I was exposed to oncology as well as advanced diagnostics, which is a really great and interesting field. But due to some issues, I would say health issues with my eyes and also with COVID coming in, I got a chance to prepare for IIM Calcutta, and I prepared for GMAT, gave my exams, and then I was selected to pursue my full-time MBA at IIM Calcutta, where I trained in strategy and management consulting. And from there, I moved to work with BCG for a while. BCG, it was BCG not in India, it was in Southeast Asia, Malaysia. And however, my heart lied in healthcare and hospitals. That is why I returned to India, back to India. And prior to Medanta, I was working with AOI, which is American Oncology Institute, as a strategy head, and now working with Medanta as chief of staff. So I would like to talk more about Vidyapit because it is this institute which has laid the foundation and shaped me as a person as well as professional. At Vidyapit, I did not find just classmates, rather, they were friends who were brothers for life. I met many seniors who were always there to guide and support, and I had support and guidance from them at every step of my life. Then there are great success stories from Vidyapit to look ahead to. Many of our brothers have already spoken on this platform, and all of them are great tech enthusiasts, entrepreneurs. Then many doctors have also spoken. We also have civil servants and many other great professionals in the batch. Apart from that, talking about personality, Vidyapit taught me discipline, humility, and resilience. So then moving to medicine as to why medicine still is relevant and why somebody should pursue medicine. It is a safe and reliable career option with high social status. And we have seen that generally many people in the batch, they either want to be a doctor or an engineer. After that, they choose the path wherever their career takes them. Apart from that, medicine is science is motion. It is a great branch of science with integration of biology, technology, as well as genetics. And with AI coming in, healthcare has a lot to provide in that domain as well. Apart from that, medicine is a profession with purpose and impact, because treating a patient of his pain or saving his life gives immediate gratification to the profession. And there are multiple career options within healthcare as well as outside healthcare, and a person can work as a researcher, academician, or an entrepreneur. So I will briefly touch base upon why this shift, why I shifted to management. So there can be certain situations where some of the professions or the departments in healthcare may feel stagnant. And this is due to the routine nature of the job, because day in, day out, you have to do the same job. Apart from that, many people feel stuck in a limited role in their own branch or department, and shifting to management can give them exposure to different aspects of medicine and overall healthcare system. Apart from that, as a management professional in healthcare, many people can contribute to the changing healthcare landscape across pharma, health tech, or AI. And if somebody is in the on the management side, they can bring bigger impact as a decision maker with ability to shape the system. So I will briefly also touch base upon different career options for a doctor in management. So one of the most sought out after job opportunity in management in hospitals or healthcare in general is strategy or strategic roles. It can be either a strategy for hospitals or any other healthcare organization or body, where the professional primarily deals with growth and expansion of the organization, P&L management, focusing on new initiatives, merger and acquisitions, and these are basically pursued by people who do graduation in any healthcare branch. It is not simply MBBS, it can be either BDS or any other branch as well. And then they have to go for a tier 1 MBA generally. Then there can be hospital operations, where the person deals with day-to-day care delivery, and they have to manage the daily operations of the hospital and ensure there is adequate and quality staffing. Then another option is hospital admin. For this, most of the time people might not require an MBA, and here people see mostly the credential and privileging of the doctors, policies of the hospitals, and whether we are meeting the compliance or not. Now coming to the payer side, which is insurance. So healthcare insurance domain is also very huge, and many doctors work there as well. And they basically work towards designing policies, management of utilization claims, and controlling medical loss ratio. Then there are other healthcare and life sciences jobs which do not pertain to the hospital domain. Rather, they are in general healthcare and life sciences, and it is consulting roles, the which is of primarily MBBs, which is McKinsey, Bain, and BCG. Everybody has their healthcare advisory division, and same is for the big fours, which is PwC, EY, KPMG, as well as Deloitte. And they do a lot of high impact projects and problem solving across providers, payers, pharma, and medtech. Then one of the major area of for healthcare professionals to work is pharmaceuticals, where they can lead medical affairs, support in clinical drug development, work on the safety of the drug, and also be part of go-to-market strategy of drug access to any particular area. Then another domain can be the medical devices, which is also on the rise. And today we have a lot of innovative medical devices all around us within the hospitals. And their medical professionals can support on product development, clinical adoption of that particular medical device, and further training and ensuring great outcomes by usage of these medical devices. And at the last, we have public health, which is generally like in India, it is routed mostly through government jobs, and anybody who is working in healthcare organizations like ICMR, or let's say on in the Ministry of Health, they can contribute towards the public health side, where they design and scale different programs for bringing good health to the overall population. And one example of this can be vaccination rollout during COVID, or in general, the vaccination schedule which we have for newborns, and many other healthcare programs which are designed for many rural part of the country. Yeah. So one of the very important question comes to everyone mind is why a hospital needs administration. So a hospital needs administration because it is a multifaceted organization which is very complex and and consists of many departments which come together to make a hospital successfully run. And the most important and at the center of it are the customers, who are the patients. And the patients in healthcare are very unique because they are different from other types of customers in other industries. Because a patient or a customer in hospital, when he enters the door of the hospital, he is stressed, anxious and unwell. He has not come here for joy, and they are the ones who are not actually willing to step to your door until unless the fate brings them there. Apart from that, the environment is heavily regulated, and we have to deal with a lot of compliances and standards. Then a hospital has to manage a lot of stakeholders, be it from projects, IT, supply chain, procurement, pharmaceuticals, doctors, nurses, and many other customer care staff are also uh, managing day-to-day activities of the hospitals. Apart from that, handling doctors is somewhat challenging because they need autonomy to function. Management cannot guide them that they have to follow this or that rule. The department and the doctor function well only if they are given a great autonomy. Apart from that, the outcomes in healthcare are somewhat like not measurable. They are difficult to measure, and most of the time it cannot be pleasant. We can have a patient getting cured and going out, and at times we can also have certain mishaps or unfortunate instances of death, or worsening of the situation of the patient while he had entered the door of the hospital. Then the landscape of healthcare has also been changing since last 5 to 10 years, and that is also one of the reason why we should have more people and some people from the clinical side also to take care part of management in healthcare. So, if I talk about changing landscape of healthcare, then digitization is one of the thing which is gradually penetrating all the aspects of healthcare. It is a utilization of EHR, hospital information system, laboratory information system. Then we have telemedicine coming in, remote care is also there, and recently we have surge of AI tools for healthcare. Apart from that, consumerism has also entered healthcare because now a patient wants convenience. Our old healthcare ecosystem was based as per the convenience of the doctors. Like every doctor was sitting in at comfort of their own clinic or a hospital, and the patient had to come to him. But now the care of the hospital is also moving out of the hospitals in form of home care or telemedicine. So everybody wants convenience, they want communication, they want empowerment in terms of knowledge and transparency in terms of what actually is going to happen to them. So transparency and communication, what I feel, had been till now one of the most important challenges of healthcare, because nobody tells the patient as to what the next step is and why he's being the cost of this particular treatment is different for this particular procedure compared to the other ones. So these are certain things which are gradually getting importance and should be resolved in coming days. And then there is also requirement for comprehensiveness, because everybody wants all the services under one roof. Earlier, what used to happen, we used to go to one doctor, and then for test and let's say radiology or blood test, we used to go to some other places. But now with rise of corporate hospitals and everything, the complete care of services under the domain of healthcare has come under one roof. Then there is rise of precision care, and with advent of molecular diagnostics, immunotherapy for cancers, then we have robotic surgery, and various AI assisted tools are also adding to the precision care. And now the healthcare has become decentralized. It's not that everything will be taken care of by a pure tertiary care hospital. Rather, each and every healthcare center, be it a small nursing home or be it a small primary healthcare center, should be equipped enough to cater to all the needs of the patient. So I would give you an example of Medanta itself. So we have 5 centers, but none of our center is like dependent on other center. Every center is independently functioning. So if I talk about different components of hospital administration or healthcare management, so it ranges from strategic planning to facility management or typical project management. So if I talk about strategic planning, it is about deciding on the long-term strategy of the hospital, like what all branches to be should be there in the hospital, and how different departments will grow with addition of manpower as well as addition of technology or equipments. Apart from that, financial management is a day-to-day routine activity. Human resource management is also very important and key component of hospitals, because we have to constantly hire doctors, nurses, and other staff members. And obviously, clinical operations and maintenance of compliance and standards is one of the key aspects of maintaining health care quality for any hospital. And infrastructure also plays a very big role in functioning of a hospital, because the way a hospital is designed, it should function for next 15 to 20 years. Otherwise, there can be some capacity constraints. So my journey from diagnosing cancer cells to analyzing numbers, and these are certain numbers which I have mentioned here on the slide, which we generally monitor as part of the management team, which is obviously the average length of stay of the patient, what is our equipment utilization or OT utilization, and these define our operational efficiency as an institution. Then financial performance is also something important, because this is what keeps an organization running. And at the core of everything is patient care and quality, where we constantly monitor hospital acquired infection rates, readmission rates, patient mortality rate. Although measuring outcomes are difficult in healthcare, but these are certain parameters through which we ensure that we are delivering quality. Then digital and IT matrices have also taken a front stage these days, because these actually add to operational efficiency in general, and also bring about enhanced customer experience for the patients who are coming in. And then obviously regulatory compliance and adherence to it is also very important for hospitals. So talking about healthcare management, I would say that it is not it is not something which is away from challenges, because most of the time people have to balance finances with quality in healthcare. The cost of each and everything is gradually rising in terms of equipments. If I talk about manpower, everything, and we have to balance all of that to provide quality care. There are certain resource allocation dilemmas as well. Sometimes we have to decide between hiring a person or getting a new technology in house. Then there can be revenue and quality challenges as well. But in my opinion, a hospital with a strong revenue can fund on various training programs and modules, and in a way they can work towards improving the patient outcomes. And regulatory and compliance pressures are always there, and there are multiple regulations which keep coming in, and we have to navigate through them. There are many pricing pressures as well which come into play. So these are the common challenges which anybody in hospital management might face on a day-to-day basis. So now moving on to the final this thing, which was the gist of our discussion, whether this transition for me is right or wrong, or for anybody in general it is right or wrong. So I would say that we do not have a definite answer for this, but this part depends on the individual aspirations, skills, and evolving need of the healthcare industry. It may seem right for someone who wants to bring a system level impact, because being in a position of decision making, or being in a position of management, you can influence policies and processes which can affect a larger group of people. Being a doctor in management, we can bridge the gap and bring clinical perspective to administrative decision. And also this opens doors for many leadership positions in hospitals, as well as other healthcare domains such as consulting, pharmaceuticals. And sometimes it might feel wrong, because there is a loss of clinical touch. That is what a doctor aspired for while he chose medicine. And people have to learn different skill set while making this transition. which is learning finance, operations, HR, projects, everything. And also, if you are in an administrative role or position, you have to navigate certain nuances of bureaucracy and all. And these hurdles are always like part of life, be it everywhere. So this is it about whether my journey was right or wrong, and I wanted to give a perspective on my journey from medicine to management and how healthcare management is important and essential for the healthcare domain. And this is my number and email ID, so I'll share with everyone as well. And thanks.
So if anyone has any questions, like they may ask.
बढ़िया एक चम्मच डाल दीजिएगा. So hi, sorry I'm outside, that's why, but wonderful presentation. This is Vikas from 84 batch, probably.
Yeah, hi, Dada.
Yeah, hi, probably pretty similar to me. I mean, I also graduated in physics, went on to do law, came back to the university, did an MBA, and now in the area of public policy. So it's wonderful to see Chandan, somebody who's really digressed. And I really personally definitely feel that this, cross fertilization of disciplines is the way forward. I mean, and we are seeing multiple examples that are coming in and everything. But I mean, the question that I would have for Chandan is on a lighter note. So, I mean, earlier he was a doctor, now he's an administrator. So how difficult it is to deal with doctors now for him? I mean, I just wanted to, yeah.
So Dada, I would say it is difficult, and but at least it is easier for me to navigate some of the nuances because I'm a doctor and I can talk their language as well.
Yeah,
So
yeah, I
better
can
to,
understand that.
yeah.
And which part of the country did you, was your home, Chandan? I mean, just a
So I
question.
belong to Bihar. It was in Aurangabad. The
Okay.
district was Aurangabad. But
Mhm.
I grew up in Odisha because my father was in Coal India.
Oh, okay, okay.
Yeah. So he was working with MCL at that time. So
Mhm.
I grew up in Odisha, like spent my childhood there, and like was part of Vidyapit. After that, I moved to Delhi. Uh,
Yeah, that I saw from your profile.
yeah.
And you are currently also based out of Delhi itself, right?
Yes, currently I'm in Gurgaon. Yes.
Good. So we hope to see you in one of the NCR get-togethers. I mean, we haven't had for a long time, but
Yeah.
hopefully we'll see you sometime. Yeah.
Yes, yes, definitely. I will join. Till
Yeah.
now, I have not been able to join any because earlier I was busy with my medical studies. Then all this transition also was very demanding because I went like I left my job and everything. Went ahead to pursue MBA from IIM Calcutta for 1 year.
I know that was a risk that you took. I mean, I can
Yes.
understand that
Yeah.
definitely. No,
Because
wonderful. It's
because
really nice that you could do. I mean, I'll request anybody. I mean, probably Vinay Subikida or somebody to add you.
because
We have a WhatsApp group also. अच्छा है,
Yeah.
दादा है यहाँ
because
पर. Okay.
because NCR रियूनियन तभी होएगा अगर तुम आओगे पक्का. तुम
नहीं, हम
आते तो
आएंगे
हो
आएंगे
नहीं. नहीं
आएंगे
नहीं.
दादा, आएंगे
अगर
आएंगे,
तुम
जरूर आएंगे.
पक्का करो तो मैं फिर चंदन को भी बुला लूंगा, सबको बुला लूंगा मैं.
ठीक है दादा,
विनयदा
ठीक है
खाली
दादा.
विनयदा खाली एनसीआर वालों के लिए ही एनसीआर मीट होता है क्या?
नहीं नहीं. कलकत्ते वाले भी आ सकते हैं भाई.
या हमारे पास रिच एक्सपीरियंस है.
हाँ, आई नो.
Chandan, just like Vinay,
Yes.
do you ask anything like?
नहीं नहीं, ठीक है, कैरी ऑन कैरी ऑन.
Chandan,
Hi,
like I just wanted to know
Vikas.
how.
Mhm.
मैं
हाँ
गौरव
दादा,
बोल रहा हूँ.
हाँ दादा.
हाँ,
हाँ दादा, आवाज
हाँ.
वही मैं समझा कि दादा आप कहाँ से आ
चंदन को
गए बीच.
चंदन से 2-3 लाइन हम भी बात कर लें.
हाँ,
नहीं
हाय
नहीं,
गौरव
दादा
दा,
आप पहले बात
कैसे
तो
हैं?
करो.
क्या
चंदन,
चल रहा है?
मैं गौरव प्रियदर्शन हूँ, तुम्हारा इमीडिएट सीनियर.
हाँ
मैं
हाँ,
अभी फोर्टिस में हूँ
पता
एज
है.
ए सर्जन. तो
हाँ, पता
पहली
है
बात तो
गौरव
हम लोग बहुत खुश हैं कि तुम्हारा जो जर्नी पूरा सुने और पहले भी जो हम लोग देखे,
दा जी.
वही है जो दादा ने, विकास दा ने बहुत अच्छा समअप किया कि यू हैव क्रॉस फर्टिलाइज्ड एंड राइट नाउ यू आर डूइंग अ वेरी गुड पोजीशन एट अ वेरी गुड हॉस्पिटल. तो
Yes.
उस हॉस्पिटल में क्या होता है ना, हम लोग का कैलकाटा तो ठीक है, टायर 1 सिटी है, बट कई बार क्या होता है कि सम पेशेंट्स हम लोग के होम टाउन से, बिहार से, झारखंड से या कलकत्ता से, दे अल्टीमेटली नॉर्थ इंडिया दे हैव अ फिक्सेशन विद मेदांता, राइट? तो तुम वहां पर हो, इससे हम लोग को बहुत साइकोलॉजिकल सपोर्ट मिलता है. आज तक काम नहीं पड़ा, वो अलग बात है, अच्छा है काम ना पड़े, but to make a choice of the doctor, sometimes आपको पता है कॉर्पोरेट में पता नहीं चलता है कि किसके
हाँ
पास
हाँ
जाना
वो तो है
है ना?
भाई
तो
बिल्कुल
वो एक चीज है। और दूसरा चीज तुमको ये बोलूंगा, मैं भी पहले आरकेएम का इस वाले ग्रुप एक्टिविटीज में थोड़ा कम पार्टिसिपेट करता था,
हाँ
बिकॉज वी
हाँ
ऑल हैव पॉसिटिव ऑफ टाइम. So would
यस
request you to start with your NCR meets and
यस
try to get, of course, we are all busy with our lives, but try to get little bit active in the WhatsApp platforms. और आओ, ये तो एक ऐसा हम लोग स्कूल से पढ़े हैं जहाँ पे जब आओ तब वेलकम है, राइट?
बिल्कुल बिल्कुल गौरव
So
दा
you know, the more we talk, more we meet,
हाँ
the more the intimacy grows, right? Across the
डेफिनेटली
batches.
डेफिनेटली
तो बहुत सारे
डेफिनेटली
हमारे सीनियर ल्यूमिनरीज हैं, कुछ लोग अभी ऑनलाइन है, तुम नहीं जान रहे होगे.
हाँ
जब जैसे तुम
हाँ
एक्टिविटी में थोड़ा सा पार्टिसिपेट करोगे, यू विल गेट टू नो.
No, no,
बिल्कुल
best is to contact Gaurav because he is a star.
No, 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 nothing like that.
ठीक
So, Chandan, all the
हाँ
best. We hope to listen
यस
more from you. And it
Yes,
was a beautiful
thank you,
presentation.
Gaurav da. So,
Welcome.
अभी क्या
Welcome.
है गौरव दा कि it's not only Gurgaon as part of Medanta group of hospitals and chief
Yes.
of staff मैं लखनऊ पटना इन सब से भी वो हूँ कहीं भी किसी को भी किसी भी प्रकार की कोई जरूरत हो if
बस
any
बस,
so
ये बहुत बड़ा
I'm
सपोर्ट है,
always
ये बहुत
there
बड़ा सपोर्ट है. Yes.
हाँ ठीक है
हाँ, चलो,
Uh,
all the best. See you.
yeah thank you
और
thank you
चंदन, आई मीन जस्ट टू ऐड टू दैट, जानते हैं ये जो विनेदा वगैरह का हम लोग का जो एनसीआर का प्रोग्राम होता है ना, तो अच्छा ये हो गया कि आपके जाने के बाद मतलब आप लोग यूसीएमएस वहां से मौलाना आजाद से निकल चुके हैं. अभी काफी लोग हम लोग के हैं जो कि एनसीआर में इंजीनियरिंग कर रहा है, कुछ कर रहा है. और आप लोग जैसा एग्जाम्पल देखेगा ना, तब उन लोग को भी थोड़ा सा दिमाग में आएगा कि जो वो बोलते हैं ना कि लिखे लिखे सब चले, लिखे चले कपूत लीक छोड़ के तीन चले सूरमा सूर सब. वो थोड़ा लीक हट करके मतलब अगर कोई मुझसे पूछे आज की डेट पे कि मैं बीटेक कर रहा हूँ आईआईटी से, मेरा नेक्स्ट बेस्ट ऑप्शन क्या होना चाहिए, तो हम एकदम बोलेंगे कि लॉ कर लो और आईपीआर के लॉयर बन जाओ. आई मीन विनेता भी लॉयर है और वो उसको सपोर्ट करेंगे. आई मीन वो सब टाइप का
Yes.
कॉम्बिनेशन जो है ना, वो एक्चुअली में गोइंग फॉरवर्ड वही सब अच्छा रहेगा, काम करेगा, सक्सेड करेगा. तो एक बार आप लोग जैसे लोगों को लोग देखेगा तो वो लोग भी सोचेगा कि व्हाट एल्स कैन आई डू अपार्ट फ्रॉम द ऑफ बीटन ट्रैक जो होता है वो. इससे
yes
थैंक यू वेरी मच फॉर डूइंग दिस. थैंक यू.
yes thank you विकास दा
Sada, like I wanted to ask two questions. Like first is if you know like if you can say on what is the condition of medical like hospitals in northeast region of India, like, uh, what is lacking and what can be done. Like uh, from my interaction with my friends, like they say that the facilities are not quite in the northeast region of India, and they mostly come to like Kolkata and like nearby like states.
Yeah.
Like so, Dada, so if you can speak on that, and the second is Dada, like how has like I am Kolkata, the MBA in I am Kolkata has helped you in like shaping to become a like management personnel, like
yeah
who is able to handle things now.
Yes, yes, because so I will talk about both. First about the situation of healthcare in Northeast. So in terms of like disease incidence and prevalence, I would say like Northeast for India is a place where cancer incidences and prevalences are very high, and we did not have a lot of care options in that territory. But if you see today's situation in last 5 to 10 years, a good hospitals have come over there. There is TMH Guwahati has come in Assam. Apart from that, in we have NGRIMS, a very good medical college also came over there. Apart from that, Medanta is also planning a hospital. It was announced few months back, I would say. Medanta is coming with a 450 bedded hospital in Northeast. So what Medanta is trying to do is we are also trying to increasing the access of healthcare in different regions, because unlike Max Fortis, we are not primarily present in tier 1 cities. We are in Patna, we are in Lucknow, we are in Ranchi, we are in Indore, and now we are also going to Northeast, Raipur, and all these places. So this is how the things have been growing around in healthcare. And Northeast it was definitely unserved like around 3 to 5 years back, but now the things are changing, and we are seeing many corporate hospitals and bigger chains also entering the market, and they will eventually change the overall landscape of that particular territory. So
Dada,
that is about Northeast. Yeah, go ahead. Yeah, tell me.
just a follow-up question,
Mhm.
Dada, the industry is not there just because of like the customers are not able to pay, or Is there any kind of like
No, so
issues?
it's not always the paying capability. See, majority of the hospital chains, they started in North India. So, and most of these hospital chains which you see today, they are not something which were built by government or a group of people. Those are family owned businesses. Even Apollo was started by Dr. Pratap Reddy. Medanta was started by Dr. Naresh Trehan. Similarly, Max and like Fortis, they are of different sort, but their presence is primarily in tier one cities. But then many people want to go there, and eventually, like obviously the financing pressure and everything, and the ROI, what is required for the investment which will go in there, is a question. But now we have a lot of support system also. So in Northeast, there is a special program by Government of India as well as state governments as well to support many people who are from the lower strata. And if you talk about bigger hospital chains, you will see that everybody has now started serving CGHS patients, which was not the case earlier. Like Max Group, even today, they are more dependent on cash patients. But if you talk about Apollo or many other, like even Medanta as well, they all serve CGHS patients. So the patients who are supported by government or state government, they can easily come to take service in these corporate hospitals. So these things are gradually like being taken care of. Apart from that, if you talk about the like cost and everything, then they also have CSR programs through which they fund a lot of things. So we have a special service program where we actually fund people who are below poverty line for diseases like congenital heart disease of children. If somebody requires a transplant or something, then there is a provision for that also. But then uh, people have to be genuinely from that strata. Many people also come up with many, like fraudulent documents and databases, which was earlier seen in the case of ESIC. ESIC is also something which serves the lower strata of the people who are daily workers and low wage workers. But a lot of corruption was going on. So these things are to be also taken care of. Then we also have Ayushman Bharat. So Ayushman Bharat is also supporting a lot of patients in various communities, and corporate hospitals are taking Ayushman Bharat patients. So I will tell you, in Medanta Ranchi, 70 to 80% of our cardiology and neurology patients who require critical care and a good setup to actually survive, they are being served through Ayushman. So this is not the case. We have to serve all categories of patients and people, and it is just a myth because it seems from the infrastructure and everything that this will be a costly hospital and setup. Even the Medanta Patna, which is there, it is built on public-private partnership. So government has given the land, and we have much cheaper rates and affordable rates compared to other corporate hospitals, be it Paras or any other in that territory. And there is a provision with proper documentation to serve people who are below poverty line.
Thank you, Doctor.
Yeah. So now coming to your second question, like how IIM Calcutta helped me in transitioning to management. So I was looking towards management since very long because with my first exposure to private hospital, I got to know about this branch and it seemed lucrative at that moment. But then like I shifted to AIM, so it took a back seat at that moment. But after that, while I decided my so as I told earlier, many of my friends, seniors, and colleagues, primarily from Vidyapit, they suggested me that you should go for a full-time MBA and not a part-time MBA, because this is a general practice in the industry that many people can opt for this thing. Part-time healthcare course, but that actually does not help you in transition. That will not help you in complete transition. It will give you some knowledge, but this will not help you in complete transition. And this full-time MBA from IIM Calcutta helped me in a complete transition because I was selected out of campus to BCG, which would not have been possible if I would have done any part-time MBA or any other MBA. And BCG is one of the top tier consulting firm, and it was the only international offer which I got. And I had a good exposure over there. Like it is a great company and everything, but then obviously I was not liking the place, and I always wanted to be back to India as well as in the healthcare sector. And this IIM as well as the BCG combination helped me in getting into strategy roles at big corporate hospitals, and that is why I have landed here in Medanta as chief of staff. And most of our team members, even my CEO, who is like son-in-law of Dr. Trian, he is a ex-McKinsey, ex-Kellogg, and he has built a team of mostly people who are from tier 1 MBA colleges or from consulting background. So you can get in straight away into strategy roles through this journey.
Thank you, Dr.
Yeah.
Chandan,
Abhinandan.
one
Yes.
point I want to mention, for you are doing a lot of administrative jobs, and
sir.
we at NCR for Vidyapit Praktani, we have always wanted to do some medical camp thing, and
Okay.
we have a lot of doctors also here in this
Uh-huh.
NCR region.
Yes,
So
yes.
why don't you take some lead and make any sort of medical camp for the poor people, so that we can all
Yes.
participate in it, and
Yes,
we'll
yes.
just
We
give
can
a
do that.
boost to our Praktini.
Yeah, definitely, Dada. So I will connect with you on this.
Yes,
We will
yes.
discuss, and whatever you are planning, we can look forward to it.
We will be happy that
Yes.
way, because we have always been trying, but it doesn't happen.
Yeah.
But we should do it.
Okay. Yeah, definitely. I'll
Yeah.
speak to you on this as to how you are planning to do it and what we can do about this.
Correct.
Yes.
Hi, Chandan. Good evening. I spoke to you day for yesterday. My office is next to Medanta only. So we'll catch up.
Hi,
Yeah.
Swarupa. Yes.
So we'll catch up sometime.
Yeah,
Thank you.
definitely we'll catch up. Yes.
So if anyone has any question, he may ask. In the meantime, I will just float a poll. I request everyone to kindly poll so that we may know what we are lacking and where we can improve.
Because I was just suggesting right now, Swarup spoke, and why can't we have a full-fledged Praktani Adda with Dr. Swarup Sinha?
Yes, we should.
Yeah, sure, Dada. We can do that. Not an issue.
What will I speak on? Hotels and hospitality.
Yes. That is a fantastic opportunity. It is a sort of career opportunity. How people should look at it.
Yeah, we'll do sometime. We'll do sometime. Maybe see, basically, it will be more like a conversation, not
Yes.
not like what Chandan did.
No.
I'm
Everything is different.
yeah.
You will be more
More like a
hospitable.
conversation. Yeah. That we can always do. Yeah, certainly. Sometime we'll do that.
I will reach out, Dada.
Yeah, certainly.
Because one thing that angle that you should also, I mean, there were questions about Medanta, tier 2 cities and everything. One important thing that because I'm in a public policy side and I interact with a lot of healthcare industry people, obviously.
Yeah.
This particular growth that we are seeing in brands like Apollo, Medanta and others are adding a huge amount of money to the country. Because medical tourism, so a lot of Southeast Asian people, Middle Eastern people, all of them are now adopting India as a very, very lucrative destination to get their medical treatments done. So that's another angle that probably Chandan would appreciate and he would know over there. So while, yes, I fully agree that there is a definite need for a country like ours, and especially being Vidyapit people, I mean, service is always on top of our mind. Service for the poor and the people who do not have it. But there is a huge contribution that these big brands of medical industry are now doing for the country. So that's one very good thing that is happening already.
Yeah.
Actually, Medanta does a lot of medical tourism already. So I think they're doing a lot.
The entire locality is full of Arabian menu cards.
No, so what I'm trying to say, Sadhu, here is that, it is not just the pure medical treatment and the, money that you pay to a Vedanta. There is a lot of allied industry that has grown around the growth of these medical, institutions. And which is really good. Probably people don't talk about it, but that's a huge contribution that they are doing to the Indian economy also.
Yes,
Correct.
that's what the downstream industries. It is fantastic because I was staying there. The most of the houses and the restaurants, they have Arabic menu cards in Arabian languages.
So Vikas, touching about on this topic, I would say that obviously medical tourism is getting a lot of importance in India, and it was there as well since Apollo started all of this from Chennai. Initially, people used to travel to Chennai, but then they are also traveling to Delhi, and because of our lower cost as well as the quality of care which, compared to other countries, which is very good in India. And apart from all of this sector is still very fragmented, and I would say it is more of more or less governed by facilitators. So there are facilitators in different countries which are connected with people in different territories, and they basically work as touts to bring patients. So this is how this industry is currently like very I would say not transparent. And then these facilitators fight with two or three hospitals at the same time to bring their patients, and then they send the patient to the hospital from where they get more cut. And that is how, if I talk about Gurgaon, then Artemis, the largest revenue share for Artemis is built out of this international tourism. Their 40% of their revenue is from this international business, and they are only a 200 to 300 bedded hospital. Medanta being a 1300 bedded hospital, we our contribution for international healthcare is only 5%, even lesser than that. And if I talk about regularization and organization of this, so our government of India has also launched an initiative which is known as Heal in India. So they have built an online portal. So most of the time, patients themselves choose to come to a different country. Sometimes government funds the patient to come and have treatment over here. So for this government to government support, Government of India has launched a Heal in India portal, which was launched in around 2023, just after the COVID and all, to take care of these things, so that people from different countries can also come directly to take like any services at any hospital of India. They just have to list all their like doctors as well as what the charges are, and they can opt for it. So this is definitely a huge opportunity in terms of economic boost and everything. But then what happens most of the time, because an international patient is in front of you, our own domestic patients, they get sidelined. And because of that, hospitals are trying to build a separate channel for everything. Like international services will be a separate wing altogether, so that it doesn't mingle with the existing services of the domestic care.
So over there, Chandan, I have an opinion. I mean, that is true for any industry which came up. If you look at the history of any industry, capacities will automatically come up. Capacity will always lag demand. That's the beauty of any growing industry. But that capacity will slowly start coming up. People will.
Yes. So definitely, Dada, there is opportunity and people are working towards it.
So come in. And now that others are also now going to utilize and set up those benchmarks. So that's how you're now seeing these same kind of facilities coming up in, other state capitals and everywhere. So it will happen. I mean, I do agree that our own country is so big that there is huge demand for us, but that probably that's true for any industry as and when it came up. I mean, there will be, some kind of a equilibrium which will be attained later on, but capacities are coming up, and good that you people are leading the way in that. So setting the benchmarks over there. Yeah.
Yes, Dada.
So if we do not have any further question, so Dada, can we wrap up the session? Chananda, if you may permit.
Yeah. Yes, yes, Vikas.
Yeah, Vinay, you may go ahead.
It was a nice session.
Yes, thanks, Dada.
So with that, I on behalf of the Praktani brothers and the executive committee team, I thank you for your time and all the hard work which went into for the preparation of this Adda. I also thank all the attendees of this session for their patient hearing and all the questions they asked to our dear Dada. So with that, I announce this Adda is closed. Thank you, everybody.
Thank you.
Thank you.